Hi everyone, welcome back to our WVS webinar series. Today we have a very exciting webinar on transmissible venereal tumours, or otherwise known as TVTs, which is an issue that really affects a lot of the places in which WVS works. And we've got two experts on the matter to present for us today. So we have Dr. Dagmar and Dr. Vero, who deal with this day in, day out in the Malawi clinic that we have. So I hope you enjoy. If you have any questions, please pop them in the comment section and we will address them at the end. And yeah, if you want to get all your friends to come and watch now, please send them a message. But I will now hand over to Dr. Dagmar and Dr. Vero. Thank you.
Thank you very much, Beth. It's great to be here and to present this webinar. So welcome everybody. Thank you for joining us. Vero and I are speaking to you from WVS in Malawi. And we know that many of you are working in environments very similar to ours, where we have large free-roaming dog populations, limited diagnostics, limited owners' finances, and often very limited access to specialist oncology. So this isn't really intended to be an oncology lecture about these transmissible venereal tumors. We want to show you what we do in our setting when we come across dogs with a TVT at our clinic, or when we find some of them in our outreach campaigns and when we are going into the communities. So this is a great example of a massive TVT, and I'm sure people, when they see a dog like this, they might think, okay, there's nothing you can do. So particularly in a charity setting with limited resources, our first thought might be, okay, is there anything realistically to do for this animal? And obviously the communities think that as well. Like, these dogs can look horrific. They smell, they bleed. People may think they are dying of this cancer, and they may be treated very badly. They might be abandoned, or they might even be killed. But TVTs are very different tumors. And I always think for vets, it's actually the one exciting tumor that we can treat. It's one of these severe diseases that we can actually make go away. We don't often have this opportunity as vets. So I think TVTs are definitely one of the diseases that I was always fascinated with. And we should not judge the prognosis by what the tumor looks like when they come to us. And we would like to show you today that some of these dogs can make really remarkable recoveries. So first, a little bit about what is TVTs and why does it matter in our settings. So they are contagious, sexually transmitted round cell tumors, and it's one of the oldest cancers in the world. So basically, that first dog that had a TVT, that had these tumors, has transmitted the cell directly to another dog. And that was 11,000 years ago. So it's still, the cells that are transmitted from dog to dog are actually still from that first tumor all these thousands of years ago. So they are spread by physical transfer of living cancer cells between the dogs. And so it's not a virus causing the cancer. The cancer cells themselves are transmitted from dog to dog. So they're usually spread during mating, but they can also be transferred by licking, by sniffing, or when they're giving birth. They're most prevalent in the tropical regions and areas where breeding is poorly controlled. And obviously the free-roaming dogs are at highest risk. So all of this explains why TVT remains such an important disease in the populations that many of us work with. Sexually intact, free-roaming dogs with uncontrolled breeding. And the clinical signs of these are usually very typical. So the tumors can be, we call them cauliflower-like nodules on the genitals, sometimes multilobulated, most often found on the genitals. They are very friable, so they ulcerate very easily, and they are bleeding often. Often the only symptom that the owners might notice is bleeding from their genitals, which sometimes can be obviously be misdiagnosed, or the owner just thinks their female is in heat, but actually it could already be an early TVT. They can also spread to nearby tissues or to any other areas on the body, when, especially during licking. It can also metastasize to other organs, but it is not very common. They seem to grow rapidly at first, but then they remain static for quite some time. Sometimes we have some unusual presentations, and I talk about some of these later as well. So if this dog comes to your clinic, I wonder if TVT might be even on your differential diagnosis list. It's very important to check if any dog has a tumor. You should also check if there might be a genital tumor. So actually this dog, Casper, is one of the dogs I've seen years ago when I came to Malawi in 2017. Was actually that tumor in the eye actually resolved after 4 treatments with Incresti. So the diagnosis is usually just made by the clinical appearance because they're very typical. So usually you have one of these friable ulcerating tumors, cauliflower-like at the genitals or any other tumor on their genitals. If you have a microscope, then please go ahead and do impression smears. It's very easy to diagnose. It's these round cells with clear cytoplasmic vacuoles in the cells. So it's a round cell tumor. It could obviously, differential diagnosis for this could be different round cell tumors or different cancer. But these vacuoles you will only really find with the TVT cells. And then when it comes to the treatment, the goal of our treatment is eliminating the tumor. So these tumors can completely regress. It can really go into remission. But our treatment is more than just making the tumor disappear. So we also want to prevent that the dog is transmitting the TVT to any other dogs. And that's why it's so important to sterilize the animal. If you imagine you would just go ahead and treat the tumor, but you don't sterilize the animal, then you don't prevent that maybe the tumor will get infected again. So it's very important that these dogs are sterilized first, and then you would start your chemotherapy. So I will show you a few examples of the different diseases that you can see with TVTs. So we would separate them into mild up to severe disease presentations of the tumor. So the mild to moderate disease are usually very small, anything from less than 1 to up to 3 centimeter and with minimal invasion. Then moderate to severe disease, tumors that are greater than 3 centimeter with deep invasion, but still localized to the genitals. And then the severe disease is what we call when the lesions have spread from the primary lesion into the surrounding subcutaneous tissues or onto the abdomen or into perigenital regions or to any other regions on the abdomen. Basically sort of destroying all the tissue around their genitals. And basically the realities are, obviously with the small tumors, like the mild disease, it's very obvious that they are excellent candidates for treatment. But what we would like to say, don't automatically give up when you see these really big tumors. Obviously, there is the assumption that these horrific looking tumors, especially on this slide here, mean automatically that these dogs have to be euthanized. But we can just step back, and if the dog is in a good general condition, they are not anemic, they are doing well, and you have an owner's compliance, start treatment and just see if there is improvement. Obviously, on the other hand, saying that we can treat doesn't mean automatically we should treat. So it's also very important to assess the whole animal. If the animal is in a very bad body condition, if the animal is anemic, if there is a bad infection, and the animal might be in a lot of pain and maybe there's no owner compliance, then by all means, not every dog can be treated. And sometimes for animal welfare grounds, it might be better to euthanize these animals. But I'm showing you a few examples later that really very severe diseases can be treated. So yes, it's important to take on board. There are different presentations, but it doesn't mean automatically that these horrific ones can't be treated. Let's talk about the treatment that we can do, because it is obviously amazing that we have a drug that is readily available in most countries. It's actually not very expensive. and it works extremely well. But we also really have to respect this drug. It's very effective against TVTs. It's a chemotherapy drug. It's a vinca alkaloid. It is cytotoxic and anti-neoplastic agent. It's very effective against rapidly dividing cells, and it's a first-line chemotherapy for canine transmissible venereal tumors. But it is cytotoxic, so it is hazardous to both the patient and the person handling it. And if you by mistake inject it next to the vein, it can cause severe tissue injury and necrosis. So extravasation is a very serious complication, and I have another slide about that because it's very important. So obviously accidental exposure can occur if it's not used properly and if you don't use the precautions that you should. So it is essential to use appropriate PPE and that you handle the drug really safely. And we also inform the owners that the urine, the feces, and any vomit should be handled with precautions after the treatment. And we are actually handing out a little information sheet to the owners as well. Adverse effects in dogs include myelosuppression and gastrointestinal signs, which in our experience is actually very rare. So vincristine, the effective treatment of TVTs with vincristine is to give 0.025 milligram per kilogram intravenously once a week, which translates to 0.25 milliliter for 10 kilogram of the 1 mg per mil solution, which you normally get, or 0.025 milliliter per kilogram. In very, very mild cases, even one dose can be enough. Most cases would probably need 4 to 10 doses. Sometimes with very severe disease, we can give up to 20 doses. So it really depends on the severity of the disease. You have to really wear your PPE. I will show you again what we're using there. So we use protective clothing. We have a face mask, and we wear goggles. We carefully handle the drug. So usually we place the IV catheter first without gloves, just because most vets, I think, are more comfortable to place IV catheters without gloves. But as soon as the catheter is in place and it is flushed and we are happy with it, we then put the gloves on, we double glove, and then we would deal with the drug and then administer the drug. It needs to be a clean stick IV catheter placement every time. And we can never give vincristine through a questionable catheter. If you're not completely happy with the catheter, you need to take it out and place another one. It's so important. Any extravasation can cause serious problems. And I can't stress this enough, how important it is. And to make sure the catheter is placed properly, we flush before and after the injection with at least 5 to 10 milliliter of saline. Then we administer the vincristine drug very slowly. So I just want to stress this again. So vincristine is a vesicant, so extravasation can cause significant tissue injury. However, this should be only a very rare complication, because usually we make sure, like as experienced veterinarians, we make sure that the IV catheter is always placed correctly. And just as an example, so since we have been starting to treat TVT cases in Malawi, in the last 7 years, we only had around 3 to 4 mild suspected extravasation cases. And these are pictures of those. And this reflects how important a good technique and a careful catheter placement is, and that you have experienced personnel. So even though, vincristine is very, very effective, you need to make sure that vincristine is not administered by inexperienced staff without appropriate supervision and training. It's very important that this drug goes IV. If it happens, if you suspect any extravasation, you stop immediately administering the vincristine. Leave the catheter in place first. Do not flush the catheter but leave the catheter in initially and aspirate and try whatever drug might still be in the catheter to aspirate it back out with the syringe, and then you remove the catheter. It's actually better to use a warm compress to try and encourage the dispersion of the drug. And then these dogs need to be monitored very closely. You need to explain to the owners what might have just happened, and then you need to regularly call the owners and visit these dogs again and again, and check what the tissue damage is like. Obviously, give pain relief, and yeah, just keep a very close eye on them. So prevention is much better than trying to manage the complication. So yeah, that's why I just really want to stress how important this is, because it's great to use, but you really need to use it in an appropriate way. And I completely recognize that not everyone has a dedicated chemotherapy suite, and we also don't. So when we are treating a dog outside somebody's house, we can still do the best we can to administer this drug very safely. So these are some pictures of how we administer vincristine when we do home visits. Very important is that you are prepared. You know exactly what you need. And like I said earlier, some vets might not want to place the IV catheter with gloves on. They might just place it first, flush it, and then tie it in properly, and then you get prepared. Okay, so you put on your gloves before you even get your vincristine out of the cooler box. So you prepare your vincristine, you draw up the drug, you have that ready to go. You have scissors ready so that you can remove the catheter after administration. You have a bandage ready for afterwards. You have cotton wool that you put directly where you place the catheter once you remove it, and then you also have your bin bag ready to discard any material that you have used straight away. So yeah, so these are the two settings that we have when we are in the clinic, and then also when we're treating out in the field. And the picture on the left is actually from just this week, 2 days ago, and you can see everything can just be prepared on the lid of your box. The dog is held by one of our staff members. He's looking away when the vet is actually, or the vet nurse is administering the drug. And yeah, so it's very important that you know exactly what you're doing. So the catheter is placed, you flush with a lot of saline, you administer vincristine, and you discard of the syringe, you flush again with saline, and then you cut the IV tape, remove everything in one go, put everything away in your bin bag. And so yeah, it's possible to do this even in the very low resource setting. It also means that yeah, every low resource setting doesn't mean that we don't do all of this in a safe manner. We just do exactly what we can to do the safest for the animal and for the staff involved as well. And now I would like to just share you a few of the success stories. I do apologize for the gory pictures, but I guess you knew that when you signed up to watch a TVT presentation. So yeah, this is an example of a good example why we call them cauliflower-like tumors. And this dog actually recovered already, or the picture on the right is the same dog after 4 treatments. Snoop was a very severe case, and it's basically the message is some cases require persistence. And usually we say like after 20 doses, we usually then, if the tumor hasn't resolved yet, if we still have TVT cells under the microscope to be seen, we do a break and then come back again after 4 weeks. But usually most of the dogs, they do recover within 20 treatments. So yeah, you just have to be persistent. And I promise you, the owners are so grateful. Once they see what's actually happening to their dogs, you are treated like magicians, because they never thought that these dogs can recover again. And then I would just like to say, So really, most of the dogs, I know that there was only 2 things on the treatment slide, but because that's what we do. We sterilize these dogs and then we give chemotherapy. Surgery is very rarely indicated. And I would say in these 7 years, I probably only removed really 2 tumors like what you see here on the slide, where it was like a dangling tumor with hardly any connecting tissue actually to the genitals. So it would have taken a very long time. I'm not even sure if tumors like that would eventually fall off, but it was, you can see there's only really 1 stitch on the slide on the right. It was hardly anything necessary to remove that tumor. And after that, it resolved. Like we couldn't actually find any cells anymore within a few treatments after that. So that was a perfect example to do surgery on a TVT, but it's not often needed. Sometimes, especially the tissue around the genitals in females are sometimes so destroyed by the initial tumor that after the tumor completely resolved, we do some sort of corrective surgery afterwards. If there's a tissue, if there is a fistula on the aspect, like next to the vulva, and sometimes we do a surgery there, but it's not really often needed. Another example for surgeries where they might be indicated are with ocular tumors if they don't respond to vincristine, or they don't respond, after a few treatments. I think for this dog, after 2 or 3 treatments, it didn't really change much on the eye, so we did an enucleation, and the genital tumor completely resolved after 16 treatments, but we had to remove the eye. So yeah, these are examples that surgery is the exception and it's not the standard treatment, but sometimes you obviously then can improvise and also do some surgery with them. And another very unusual presentation are facial tumors. And yeah, just remember there can be extragenital disease. And in this case, his name was Chispa. It was a massive tumor, an intranasal tumor that we couldn't obviously take a smear. But then when we examined the genital, there was a very small TVT there. And that's why we said, well, let's give it a go. Okay, we were very close to actually euthanizing this animal, but we tried. We started vincristine treatment, and he responded very well. So on that picture on the right, I think that was the 10th treatment or the 9th treatment, and he recovered very well. Obviously, the tumor on the genital recovered already, went into remission after a few treatments. It took much longer with the nose, but he's doing very well. Obviously, with a tumor that size, he does suffer a bit of chronic sinusitis, but Vero has actually seen him just a few weeks ago, and he's very happy. We finished the treatment already. It was 2024. So yeah, it's been almost 2 years, and he's doing very well. He's sneezing every so often. I think he probably does have problems, like chronic problems with his sinuses, but he's doing very well. So yeah, so it's not always what you expect, but it's always worth checking. And definitely in Chispa's case, it would have been very easy to euthanize him because you wouldn't have thought that there's anything you can do with something as easy as giving weekly intravenous injection of vincristine. All right, I will now hand over to Vero, who will talk about our setup when treating TVTs in Malawi specifically, and the huge impact that our veterinary interventions can have for some very lucky dogs here.
Thank you so much, Tekla, for your wonderful presentation. My name is Vero. I'm taking over from where she has stopped. So talk about TVT treatments by WVS in Malawi. In our country, indeed, TVT is very common because most of our dogs are same-owned and they are freely roaming around. As a result, we have already said that free-roaming dogs are at high risk of getting it. So many affected dogs are abandoned, they are ill-treated. Some of them, they're even killed inhumanely because of how the tumor appears. Now we have got Pistol on my screen. I've got Pistol. She's looking very sad and nervous and skinny because of her sad story that ended up to be a happy one at the end. Pistol came here because of the neighbors that brought her, because the owners were trying to kill her because of how terrible the tumor was, bleeding and smelling and causing all the nuisance because of the foul smell, and the flies were all over. So she came to our clinic. Before we did everything, we had to do physical examination where we confirmed that it was TVT, and also she was so anemic, we had to put her on antibiotics and pain relief because she was so painful. And we had to help her because of how she was looking, feeding her, and that was also accompanied with the sterilization as well because she was not neutered by then. So we had to do all that. Then a few weeks later, she had to start having Christine. So I've got 3 pictures here. The first one says treatment number 1. That was how horrible the tumor was. But you can see at treatment number 5, Pistol was already like that, and she was putting on weight. And on treatment number 10, it was looking like that as well, which was very good, and the owners were very happy until after dose number 17. That's when we noticed that she was fully recovered, she resolved, and the cytology was also negative to confirm that she was fully resolved. So again, this is a message to all of us, vets, veterinarians, that TVT is treatable. We don't have to give up because of how horrible the tumor is. And also we have to bear in mind that that we also need to know that animal welfare is very important. So when we notice that the animal welfare is compromised, of course, euthanasia can be an option. But if you can see that already there are some improvements after a few doses, then we can try vincristine. This is how Pistol looks now. She's very happy, as you can see. Yeah, so this is the flyer that has helped us to advocate about TVT in the communities where we go to treat. So it's something that most people do not know in our country. That's when most of the dogs were abandoned and killed by stoning and everything. So this flyer has helped us a lot to disseminate and advocate about TVT. So it helps us also because nowadays people bring their dogs to us as early as possible, because by then also the treatment is not that long, because the TVT is at its early stage. So the treatment that is given is not that long. So after a few doses, the dog is back to normal because of the awareness now that everyone knows. Everything that we have shown you here is just to let you know and inform you that this is doable, and this is the ongoing study that is happening here in Malawi. So the study is just for us. We were just trying to see if this is really possible, that TVT can only be treated by vincristine without doing anything else, and also without losing the lives of most dogs. So we have been doing this since 2018 up to now. Everything is going on very well. That we have got also other patients, like Tekma mentioned, that some of these pictures are from 2 days ago. So it means from 2018 up to now, we are still doing this. We are still administering vincristine to TVT patients. We are still checking how many doses are there for one dog to come to resolution. And also because of the setting, we are not being scared that maybe we don't have enough that we can help these dogs, but we are trying our best with the resources that we are having. So the study is based in the Blantyre city because that's the closest, and yeah, our TVT patients are the one that they are our study population. Treatment wise, and the protocol that we follow is that we treat them once every week. Either they come here by the owner, or we go into their homes every week. So whenever we have got few patients, it's only once a week, but now we have got a lot of patients whereby we divide into 2 days. Yeah, so that's how we are ending up saying that it is a very common condition, a very common disease that we see here. So during each and every treatment every week, we do data collection. We use our WVS app, whereby there are so many questions there, including the location of the tumor, if the tumor has regressed or not, how many doses have this animal received, or what number of doses that one we are giving. So such kind of information, whether there are side effects or not. So that's after asking the owner how the dog has been from the previous injection. And also in the same data collection, we've got our paper records where we record everything, starting from the name of the animal, the location, and also the number of treatment and their weight. We weigh them every month. We have to weigh the dogs and record everything. So in the same data collection, for us to easily follow up which dog is this one, or to follow up whether the tumor is regressing or not, we also take a picture of the dog, especially of the tumor, together with the ruler and a unique ID that differentiates one dog from the other, because they end up having, we cannot rely on the names because they end up having the same name, maybe 4 dogs bearing a Bruce name, so we cannot know which bum is this, which penis is this. Is this one Bruce 1 or Bruce 2? Because of that, we create an ID that differentiates them. So at every treatment, after every treatment, we take a picture, just like the other picture to my left is showing. I don't know if you can see my pointer. It's showing the penis, the ruler, and the ID. Every treatment, again, we check for the regression or reduction of the size of the tumor. We check for the side effects by asking the owner how the dog has been from the previous injection. And also we check like generally how they are looking and how they are doing. If any side effect has been reported, maybe vomiting or diarrhea or stop not eating, something like that, then the treatment is delayed on that particular day. The general checkup, the assessment is done. If any needs, any medication we give to this animal. If there is any need again that you need to take this dog to the clinic, we do so. When do we determine to stop the treatment? So this is done when we have examined macroscopically that the tumor is not there anymore. That's when we say, okay, then this dog is free from TVT, we can stop the treatment, or we do the cytology. When the cytology is negative, that's when we say, okay, this is done, then we can stop the treatment. So I'm not going to take you through all the numbers, but I'm just going to mention a few so that you can appreciate how much we are doing here in Malawi, how much WVS is helping TVT dogs here in Malawi. So about 400 dogs have been treated from 2018 up to 2025. We've got a preliminary data. So we have got 400 dogs that have been treated. So from there, we have seen that about the average dose of 6 to 8 are the ones that brings out fully recovery, fully resolution to all the tumors. But again, some they can regress even beyond 8 doses. And you can see this table is showing the percentage of different locations of the tumor. Again, Dagmar has shown us some on the facial, some in the ocular. So we could also see some in the skin. So 85% of females, they have got tumors in their vulva and their vagina, while male dogs, they have got 88% of them, they have got the tumor in their penises. Like I said, it is the study that is still going on. We are not done with everything. Of course, the results that we have shown you here, they are from 2018 to 2025, but we are still having patients. So we are still analyzing and we are still checking what else we can do. So because we are thinking of publicizing the paper, so now those are the numbers that we have for now. But still, we are going to also analyze the survival analysis, maybe during or after the dissolution of the tumor. We also want to check whether the sex can affect the dissolution or the age, if the age matters to how old how old is an animal for him or her to be resolved. Is it only males that are resolving faster than females? We also want to check if there is anything different when the dogs are given the treatment at different intervals, because we have said that recommended is once every week, but there was a time during COVID we were doing once every 2 weeks. So we also want to analyze that data, whereby we were also administering every 2 weeks. So this is what we are doing, and we are still doing it, and we are given a chance. Beth, if she's going to give us a chance again, we are going to give you an update on our results. But what can you take home with you about our message today, our presentation today? Is that you have to recognize the tumor, you have to recognize that all the free-roaming dogs are at risk of getting this disease, and you have to recognize, you have to know how to examine and coming up with your final decision based on your cytology that this is really TVT. And also you have to know that it is treatable. You have to know that they can come in different shapes, and just bear in mind that you need to be patient and you don't need to compromise or start cutting the tumors. Just know that vincristine is there for you. You can do it with vincristine. Just know also that as you are administering vincristine, you have to be careful that it is dangerous, it is toxic, it can injure your animals. So what we want is not to damage their legs, is not to compromise their health and animal welfare anymore, but we want to help them. So just bear that in mind as you're handling vincristine. Remember, you need to sterilize them, because if you won't, then once they are healed, they will go back and get the TVT again, or they will continue to spread it to other dogs. So that's not what we want. We want to eliminate this disease. And also we have to remember that in each and every location you are, it's doable. It's something that you can do. It's not, vincristine is not that expensive. Even in low setting like Malawi, you can also try where you are, you can also try what you do what we do, you can also try in your country, and this is doable. So don't judge the prognosis by the appearance of the tumor. This is the dog that we saw on the very first slide that Dagmar presented. You can see how disorganized the vulva was. And now look at the last picture where she's fine. The vulva is now in its anatomical order. You can see how it looks. So this is just something that you can appreciate, that vincristine can do wonders and this can happen. So yes, thank you so much for your attention. Thank you so much for being good audience.
Oh my gosh, thank you both so much for an incredible webinar. That was absolutely amazing, really engaging, really informative. Thank you so much for sharing your experience and your expertise. And it sounds so cool, the study that you're doing. That's going to be really, really, really helpful for people to read about once that's published, and have such an enormous impact on people that are treating TVTs everywhere in the world. So thank you for all your hard work. Thank you so much. And yes, you definitely can come back for a second webinar to present your results. We would love to take some questions. If anybody has any, please pop them into the chat whilst we have a little discussion afterwards. I definitely have a question though, because I have a couple. But one of them, the first question I have is, obviously we know vincristine can lower the immune system of the dogs that we're giving it to. Have you ever experienced issues with that, and how did you resolve that if you did?
Yeah, sure. Thank you, Beth, for your question. Surely we have come across the immune suppression of vincristine to the patients. Of course, since 2018, last year was our first experience, because Blantyre experienced an outbreak of distemper. So quite a good number of our patients, like about 6 of them, they died because of distemper. Now we were thinking that maybe had it been they were not only vincristine, maybe they couldn't have died. But bear in mind that our chemotherapy does really lower their immune system. We said, okay, maybe it was also a contributing factor to it. So yeah, it was so painful because we lost some of the dogs. Some of them, they were already resolved, but they came down with distemper and they died. So it was so painful, all the resources, all the effort, it was so painful for us. So because we are a charity, we are lucky that we can receive some funds. We proposed that maybe we should be protecting our dogs, maybe vaccinating them with 5-in-1. Lucky enough, it was accepted. So now from this year, January 2026, every dog that is to undergo vincristine has to receive 5-in-1. Right now, we have got 52 patients that received 5-in-1, 2 doses at the interval of 3 weeks. So from there, we started giving them their vincristine. So from then, we haven't noticed any dog that came down with any kind of that kind of disease. So yeah, thank you.
Yeah, that sounds like a really tough situation, and kind of something that is outside of your control in the first instance, but then being able to have a really effective practical solution, such as vaccinating the dogs against distemper before administering the vincristine, then it sounds like that's obviously been really effective going forward, and you've not had more distemper cases. But yeah, distemper is a horrible, horrible disease, and especially when there's outbreaks, there's such a limited amount you can do. But well done for being good problem solvers, and making it safer for the future dogs that receive vincristine. So well done for that. And we do have another question from one of our viewers. So a bit more information about how to handle tissue necrosis if it happens, if vincristine does come outside of the vein. If you could maybe just cover that point again a little bit, that would be really helpful. Thank you.
Yeah, I think as soon, so yeah, first, I'm not sure if I mentioned, so it is really very rare usually. So I think we've seen it maybe 3 or 4 times. I think I said that. I think as soon as you place the catheter, you administer the vincristine, and you're not sure if this is going through. Like maybe you look at the vein now and it looks as if it might be blowing. Don't replace the catheter straight away, but remove the syringe that you wanted to inject the vincristine. Get a new syringe and try to aspirate through the catheter that is still placed. Try to aspirate any drug that might still be there. So just
drawing it back.
Yeah. Drawing it back.
To remove it. Yeah.
Yeah. And then obviously remove the catheter and applying a warm compress, like maybe getting warm water, use some swabs, and basically warm is better than cold. So that is also something important to know. So basically try like put a warm compress on. And then I think then you can only really monitor. It's not advisable to inject saline into this area because you might actually disperse it into, maybe you make it go even wider into the leg. So that is not recommended. I would say give analgesia. If you have meloxicam, carprofen, paracetamol, give analgesia to the dog, like an anti-inflammatory, and then monitor the dog closely. So follow up with the owner, visit them again, and treat any possible secondary bacterial infection that might develop. I guess in worst cases that I haven't seen here, the skin could slough off, like you could actually have proper necrosis there, an open wound. Then you would have to treat that secondary as a wound, maybe then with bandaging, maybe then with wet to dry or Manuka honey. It's really important to know, like, yes, it is a complication, but it should not really happen. Like a complication, it almost sounds like something that, you treat 10 dogs and then maybe 3 have a complication. It shouldn't be like that, okay? It should be extremely rare. And that's why I want to make sure of the 500 or 400 cases we're treating, we're looking at like 3 to 4 where they had a mild extravasation possibly. So yeah, it should, most importantly, clean stick IV. If your first catheter doesn't go in, if it's not, don't go above, don't go below, use the other leg. If you have got 4 legs, but if for some reason on that day you really have a bad catheter day, and we all have them, then don't give it on that day. You make a note, you come back next time. You come back in a week, and then, it's much better to just leave it. And that is sometimes what's happening. So it's so important. If you don't have it in straight away and you then flush it with 10 ml, you're going to see definitely if your saline of 10 ml of saline is going through nicely, you're fine. Okay. So make sure you don't just flush with a ml or 2. Really have your 10 ml syringe, flush with a lot of saline to really make sure it's definitely placed, and then you should be fine.
Thank you for, that was so detailed and really informative. Thank you. Our second question was a similar sort of question about what to do if it went subcutaneously. So I think we've covered that really well. Thank you. But yeah, to summarize, you just want to cold compress. You want to make sure that the animal is covered with pain relief. And then if you need to manage it as a wound, manage it as a wound and keep a close eye, monitor carefully. But I think that's all that covered. Thank you. The second question that the next viewer had was, is there any other drug aside from vincristine that could be used instead, or is it second line? I'm unaware if there is, but let me know.
No, I'm not aware. No. And we are reading a lot of papers at the moment for this study. So,
so vincristine is the first line chemotherapy that can be given to TVT, but there are some options that other chemotherapies can be used, but they are in combination with vincristine as well, or surgery or something else. But on its own, vincristine is the very recommended treatment as a first-line treatment for TVT.
That makes sense. Thank you. I have my second question now. So it still gives people more time if you want to type anything in. But you talked a lot about recording your data, the importance of doing so that you can keep track of patients, you can keep track of progress, and then obviously that is now massively contributing to the study that you're working on. But is there a way that you find it's helpful to do that? Do you put it in just physical copies, or do you use anything digital? It'd be really interesting to know.
So we always say, so we are using the data collection app. So WVS have their own data collection app, and we use it, to record all our surgeries and vaccines and stuff as well, but we can just adapt it to what we need. So I created this form in 2018, and you always think you see these cases and you're going to remember, or you're going to know where you put your paperwork. But at the moment, I realize how nice it is to actually go back. You download all that data from 2018, and for us now to go back and looking at the intervals, looking which dogs regressed after, went into remission after how many treatments, it's incredibly useful to have the full data. It's also for anybody working in charity, we know how important it is for us to report back what we are doing, how many animals are we treating, especially now as well. Like the first question that my line manager there from WVS, I said, can we use the 5-in-1? Because I know these dogs might have been killed, if we wouldn't have started to treat, but it's incredibly sad, like Vero said, when we then, multi-household dog and the one with vincristine started distemper. So, but to actually prove how many dogs we're treating, it's easy then to go back into the app, download the data, and you can tell exactly how many dogs you treated and how well they responded. So already going through all these resources, it was then easier for him to say, okay, looking at all of this, what we're already putting into it, actually giving 2 doses of 5-in-1 is really justified. So let's do it. And so I think it's for you. If you maybe want to publish the data at some point, it really helps you. In the end, you have everything in an Excel sheet. So I can, And working for WVS, I think we can say any charity can use our app for free. So I guess you can always get in touch with somebody at WVS, and maybe that's also an option for you there.
Yeah, absolutely. It goes without saying that anyone that wants more information, anyone that wants to use any of our resources or protocols that we have, and we're able to give them to you and share our experience and share our knowledge, please get in touch. And we have so much going on with the education side of things with WVS Academy, which is where these sort of webinars come through. So we have our YouTube channel where all the webinars go onto there afterwards, so you can watch it back. But we also have little short videos, little how-to videos, and we have our whole website. So there's so much that we create, and it's all for free, and it's all very accessible. So please check that out. And yeah, get in touch with us individually. We just want to help make a difference. So thank you for watching, everyone. I think, oh, hang on, we've got one more question. So we've got a question on, based on your data, what is the maximum interval that still works? So I don't know how much you can say about your actual data and results just yet, but I don't know if you can answer that in a way that doesn't reveal that necessarily.
Yeah, I think we would have to look into the analysis, because it's mostly the walk-in dogs that, we tell them come back in a week, but then often they don't. And then like very extreme cases, they come like for 2 weeks, and then they don't come for a long time. And then they turn back 6 weeks later and the tumor is literally gone. So that's an extreme one that, then we would give another dose and then it's actually in remission. So I think this will be something, it's not really that we planned it like outside of COVID, where we just didn't have the staff and the resources to go out every week or to pick up the dogs every week. Otherwise, it's just coincidence. We also get a lot of dogs, and I get typical complications as well for our settings is the dogs don't turn up and the owner is not there, your car breaks down. You can't actually, you can't get hold of them. They change their phone number. Like there's so many things. Like there's a lot of dogs that we started and then, we have a dropout of like partial resolved dogs are usually not because we said, oh, this is enough. It's because we then couldn't get hold of the owners anymore, or the dog ran away, or the dog, something happened to them. So yeah, that will definitely be something we're going to look to when we analyze the data for the paper, to say, I would say it looks like really the weekly interval is the best. It's faster. Like, we definitely, during the COVID time, we didn't yet have this cutoff of like 20 treatments and then, let's stop. We actually went on for like 40 treatments, and then we said, okay, I think this tumor stopped responding. So it could be that they maybe stop responding if you have these longer intervals. But definitely everything is better than nothing. And I can't give you an exact
Interesting. Well, you'll have to come back for our second webinar when the results have been analysed, and then you can see. There's another question about potentially using ivermectin. Personally, that's not something I've heard of, but the viewer does provide some publications potentially, so I'm not sure whether that's come up at all in your research.
I think ivermectin comes up with everything. It seems to be actually curing. Especially, I'm not sure this person is from South Africa, but definitely South African love ivermectin. Apparently, it can treat everything. Now, no, there's definitely some interesting data, especially since COVID. I think we all looked a little bit more into ivermectin because apparently it's really curing everything, but not particular. Actually, no, you said something about ivermectin before, right?
Yeah, I think I came across a certain paper whereby ivermectin was included as one of the combination of vincristine and vincristine and ivermectin. So to me, at some point, I think it was because one of the side effects that you can see with vincristine is hair loss. So they'll develop like alopecia. So sometimes they can confuse with mange, not knowing that maybe the mange was already there, or maybe because this dog is losing hair because of the vincristine. So that study, they included ivermectin, especially to some dogs that were having hair loss. So, of course, at the end, they came out nicely. So, to me, I don't really understand whether they were in that combination to say we are treating both the dogs, because it was biased to the dogs that were showing hair loss. So, I'm not certain.
So I guess for us particularly, we didn't find the need yet to try something else because we have such good results. Some dogs that have mange, and we can also analyze that because we always made a comment, mange, and then we also gave ivermectin, but I guess we wouldn't have numbers big enough to actually say anything about those.
Okay, thank you. We have somebody who is asking a question from Goa in India, saying sometimes the free roaming dogs are very difficult to catch, and is there any way to slow down tumor progression with them? But I guess it's exactly what you're saying, is as and when you can catch them, any dose is better than no doses. Would that be right to say?
Yeah, and especially it will come again to the sterilization, right? It's so important to then do outreach, catch these dogs, catch, neuter, maybe give them one dose on the day, but at least I think then it comes to herd management almost, and make sure that these dogs are not spreading it to others. So we do that often as well. When we do outreach here, unless they are in Blantyre, we can only really sterilize them, give them one dose. And I think then we have to look at the big picture for the rest of the dog population, but there is no alternative that you can give oral or something like that.
Okay, yeah, perfect. So we've just had a couple of other comments, so I'm just having a quick read. Yeah, somebody has said that they've been monitoring some of their own results, and they've found that extending the interval to 14 days just extends the time to resolution and the number of treatments that is required. So it sounds like that is in line with what you guys have been seeing as well. But they said they didn't do any formal experiment. It was more just a reflection on some of the data that they'd gathered. So yeah, very interesting. And yeah, another comment just saying that potentially, I think someone has read somewhere that there might have been a paper saying that ivermectin can help to cut recovery time down, but I guess none of us three have read that paper. So we're not necessarily saying that is the case, but interesting that there are potentially some other options out there, or maybe other people doing some research into an addition of other drugs.
Yeah, please share. That would be very interesting.
Yeah, I think she's provided some links, so I will send them across to you as well. But thank you so much, everyone, for engaging so well and asking some brilliant questions. That's really interesting. Great to have these discussions. And yeah, it's been really nice to have you guys on the webinar series. Thank you so much. We'll definitely have you back. And yeah, just to say, please check out our YouTube channel, our website, and get in touch with us if you have any more questions. Thank you again, Dr. Dagmar and Dr. Vero.
Thank you.
Right, everyone, take care and have a lovely evening. Bye.
Bye.